Hey guys, so I'm late to class again, but basically had breakfast real quick, and right now I'm off to class. We have like a mandatory class right now, and then after that I'll hit the gym real quick and come back home, have lunch, and study.
I got my city on lock, I got the internet buzzing. Every song that I drop, you got the fireman coming. Bringing that heat with the CD. When they see me, wanna be me. Better believe that I'll be free in a big league, not pee-wee. And they got cheese like CC's, I'm never gon' flop. Looking back down from the top, never caught up on a loss. Ballin' cause I've been a boss, they follow me like I'm the law. Put all the weight on my back, gon' be a legend like my name is Shaq. Gon' be a funeral when I attack, so watch how you act. They never thought I could've rapped, damn. I'm one of a kind, that's something. Texas Hold'em, not bluffing. I'm a
Hey guys, I just came back from the gym, did a quick pull workout, and overall it went pretty well. My list have kind of been stalling recently, but you know, I'm kind of busy with a lot of things right now, so as long as I'm making like slight progress, that's decent. And I've also been cutting weight a little bit, so it's kind of harder to make progress. So I just had my lunch and it was basically the same things I usually have, you know, chicken breast, veggies. I did have some non-fat Greek yogurt as well, and some sugar-free, fat-free, low-calorie Jello. I also had 2 Costco protein bars, and I reviewed those yesterday. Hey guys, I'm in the future. So I was in Costco recently and I found out that recently they released 2 new high fiber protein, lower calorie, low carb bars. And these are the cinnamon roll bar and the chocolate peanut butter chunk bar. And they've had the chocolate chip cookie dough or the chocolate chip chunk or something like that, and the brownie flavored ones, but they released 2 new flavors, and I'll try these out for you guys. One thing I do notice off the bat is one problem with Costco bars is they tend to not have the best form quality control, so you can kind of see like the bars all like kind of like bent and like scrunched up. And one good thing about having like actual like Quest bars or One bars or different other high fiber, high protein bars is that they tend to have consistency throughout with like the form, so it's not all like beaten up, which doesn't really make much of a difference taste wise, but I feel like when you're eating something, it's nice to have things that like look good, not just like squished like balls of like protein or something. So here's the cinnamon bar. It kind of looks like a a bent piece of like poop or something, but yeah, it's kind of like beaten up like here, but yeah, I'll give it a try. So it does have a relatively soft consistency. It has a nice like cinnamon overtone, and it's not like overly sweet, so it kind of tastes like a doughy graham cracker kind of. So overall it's a decent bar. It's not like crazy good, but it'll definitely do the job, especially if you want a decent, cheap, high fiber, high protein, low carb bar. So the next bar is the peanut butter bar, and this one actually has a little bit more form, which I actually appreciate. I kind of like it when my bars actually have like that rectangular prism kind of shape instead of just like being like smushed and poop like. So the consistencies are pretty similar. They both kind of like have a little bit of a doughy texture. The peanut butter bar does have a pretty strong peanut butter taste, so if you guys like peanut butter, it may be a bar for you. Again, it's not like super sweet, so it's not going to be something that's going to be like a Reese's peanut butter cup or anything like that, but it definitely gives you a little bit of peanut butter taste, and it's a nice way to get in some protein and fiber. So overall, I think I give both of the bars a thumbs up. They're both good options, and they're pretty cheap since Costco sells them for I think a little over $1 per bar, whereas like a lot of Quest bars and other protein bars tend to sell for like $2 to $3 a bar. Anyways, I'll catch up with you guys back in the future. So we're back in the future, and right now I'm basically just going to be relaxing for a little bit, and I'm probably going to start for like an hour or two since we have a team-based learning session in the evening or in the afternoon, which is going to be mandatory. We're basically walking through a patient case as a group and working through the case based on different prompts we have and different information like labs that we have. And so it's basically a young girl that had an early teen that was like a gymnast, and that was like a competitive gymnast that had anorexia. Basically had symptoms like weight loss. I think she had hypotension, and we basically concluded that she had anorexia or bulimia. At the end of our first day of team-based learning, we learned that the patient went to a rehab. They were able to successfully, or relatively successfully, overcome their eating disorder. So they were able to get some counseling and I think nutrition therapy and things like that, some CBT, cognitive behavioral therapy, and they were able to recover relatively, but they came in a few years later with having changed sports to something more team-based, so there's less individual stress on our patient. And she had a soccer incident where she got hit and her distal lower leg was bruised, and on x-ray we found out that there were some signs of osteosarcoma. So a little bit about osteosarcomas. So osteosarcoma is the most common malignant bone tumor. It's a malignant tumor of osteoblast of mesenchymal origin, and they produce osteoid material. It's associated with different kinds of mutations, such as the retinoblastoma mutation, although the disease isn't very well understood. It's usually found in the metaphysis of long bones. So if you look here, the epiphysis is the ending, the diaphysis is the inner shaft, and the metaphysis is the area in between the epiphysis and the diaphysis. This is also the area where the growth plates are found and where the region that kind of grows and lengthens as children develop. So about 40% of osteosarcomas are found in the femurs right here. About 20% are found in the tibia. About 10% are found in the humerus, 10% in the skull and jaw, and 10% in the pelvis. Osteosarcomas account for about 20% of primary bone cancers. They're the primary tumor in males 20 years old and younger, and they account for about 400 cases per year. The 5-year survival of osteosarcomas is about 63%. In males, it's about 60%, and in females, it's about 70%. And interestingly, the incidence in males is also a little higher. It's about 5.2 in about 1 million individuals, and in females, it's about 4.5 in 1 million individuals. In the elderly, osteosarcoma is not really a primary diagnosis as much as a secondary diagnosis. So it's usually secondary to diseases like Lee-Fraumeni syndrome, which results from a germline mutation of P53, retinoblastoma, Paget's disease of the bone, things like a lot of radiation and bone infarcts. So a lot of bone dysplasias. Risk factors are, again, bone dysplasias, rapid bone growth, genetic predispositions for different things, and some of the risk factors aren't really well understood right now. Osteosarcoma presents with a painful enlarging mass that sometimes has pathological fractures but sometimes doesn't. There's often a history of trauma, and on radiography, certain signs can be seen, such as Codman's triangle, which is a lifting of the periosteum off the bone. And you can kind of see the triangle shape right here as the bone lifts off the periosteum. The sunburst pattern occurs, as you can see on the right here, when the osteosarcoma extends through the periosteum, creating the sunburst effect. Osteosarcoma is pretty aggressive and it spreads pretty aggressively. The primary disease usually is responsive to treatment, like chemotherapy and surgical resection, but not the secondary as much, although even primary disease is pretty aggressive and the prognosis isn't the best. Systemic symptoms aren't usually seen, things like fever, night sweats, and physical exam usually doesn't reveal much. Respiratory findings are usually not seen unless it's late in the disease course. Masses may be seen, but sometimes they're not. And lymphadenopathy isn't always seen. There could be decreased joint range of motion, though, if a certain joint is affected. Patients usually die of pulmonary metastatic disease. So there's a pneumothorax, as you can see here, air in the lungs, and then there's also metastatic lesions throughout the lungs. For your workup, you do things like the ALP and LDH, which do have prognostic value. A high ALP at the time of diagnosis kind of increases the risk of that the patient has pulmonary metastasis. You'd also do things like a CBC with a differential, platelet count, liver function, renal function test, electrolytes, and urinalysis, and you do this before surgery, as ideally you'd start some kind of neoadjuvant therapy before surgery to kind of try to control the tumor and maybe even reduce its size. And then you'd continue these lab tests post-surgery as you try to further treat the patient and give the patient more chemotherapy. So the workup again would be things like radiography, bone scans, chest CT, as I showed you on the right, to determine things like pulmonary metastasis, MRIs to determine if there's intramedullary disease or if there's soft tissue lesions, and also you try to figure out the staging of the tumor. For management, you do a biopsy and a resection. So you want to make sure you do an adequate resection to take out all of the cancerous tissue. You can also try to resect out some of the lesions and the cancer spread in the lungs, but if there's a lot of nodules in the lungs, it may be difficult to remove all of them. You'd also administer chemotherapy for the patients, usually a multi-drug regimen. I think for our patient, we had about 3 or 4 drugs that they were on. Unfortunately, a lot of the times, the prognosis isn't the best, so palliative and hospice care may be needed, especially if the patient is end of life and doesn't have many months left to live. And this may be the best course of treatment to allow the patient the best end of life and the most comfortable end of life possible. Okay, I hope you guys enjoy that. Let me know if you guys want me to keep doing it or not. Again, I'm just going to relax a little bit and study for a little bit and then go to my team-based learning session. Hey guys, so I just finished my team-based learning and we basically got some more information about our patient who had osteosarcoma. So she had to come back to the hospital like a year later after her osteosarcoma diagnosis. She had to have a below knee amputation because of her, there was like a risk for infection. I think there were like signs of like osteomyelitis and things like that. So the limb had to be amputated, unfortunately. And so after the team-based learning, I basically just went out for a quick walk. Right now I'm home and I'm kind of tired, so I'm probably just going to be watching YouTube and relaxing for a little bit. So I got some tomatoes, some grape tomatoes right here, and I'm going to be just like snacking on them. Maybe some non-fat Greek yogurt again. But if you guys have been sleeping on grape tomatoes, or just like tomatoes in general, I know like my brother hates them, but if you guys have been sleeping on grape tomatoes, you guys have to get on that grape tomato game. Anyways, I'm gonna get through probably most of that container. I think it's like, what, 2 pounds, 3 pounds? Yeah, just watch some YouTube, relax, and probably get back to studying again because, you know, that's like med school life. And it's like I think it's about 2 months from STEP, so like we're supposed to be studying for our board exams while we're doing our current block, which is like stages of life / like human development kind of. So I just studied for a little bit and now I'm gonna do some art. And the piece I'm doing right now, it's gonna be on my Instagram, I think in maybe a few days, I think, hopefully, if I can finish it this week. So I'm probably gonna be uploading a time-lapse / speed drawing of this piece and maybe do like an instructional voiceover. So yeah, art time, then probably have dinner, again, my usual stuff, my protein smoothie because I'm part of the pond water crew, and probably have some carrots, and then I'll study again and then I'll head off to bed. So that's probably going to be the end of this vlog. I hope you guys like following me through kind of like a day in the life of a med student again. And this time it was through our stages of life block. It's our last block and we have like a couple weeks left. So kind of stoked to just focus on STEP instead of trying to balance like STEP and like the block work. But yeah, thank you guys so much for watching. Make sure to subscribe if you haven't. Somewhere here, I still don't know where the button is. Make sure to like this video, share it with your friends. Comment down below if you have any questions, comments, suggestions, or video ideas. I don't know, anything like that. All my social media links are down below. My art page, my personal Instagram, my fitness Instagram. If you guys can find any other of my Instagram pages, maybe I'll I'll give you guys a gift card or something. I don't know. Remember, you have one life, so make the most of it. Hope you guys have a great day. Take care.